My senior dog, Gretel, this one here, was just diagnosed with kidney disease. And a lot of pet owners, I'm making this video to help people, but I know that I have asked myself, how did we get here? Like, how did this happen? Why us? Is there something I could have done differently? Why is it my dog has kidney disease? What did I do? What didn't I do? Things like that. And, I'm going to go through that kind of those questioning things here in the video and talk about, this isn't the way I wanted to relaunch our YouTube channel, but we've been around since 2010, mostly on Facebook and Instagram, a little bit here and there on YouTube. And we have a lot of people very interested in following along, like invested in, I say we, it's me and the dogs. I don't know, it's their channel as much as mine, but who are invested in my dogs and what's been going on with them. So I kind of want to do a recap video of where we are today. It was just a few days ago she was diagnosed with kidney failure. And so I want to give a timeline of kind of how that happened and some of the thought process and where we're at today and where we're going. So I have notes. So I will be looking down to read my notes because I just want to make sure to cover everything. And I am getting over a cold. So I'm sorry if I cough. I've tried to do everything I can to not cough. But so I'm just going to start kind of how we got here. Just a timeline. One thing I've learned over the years, just both personally and when it comes to my pets, like to apply it when it comes to my pets, is that there are two kind of realities or two aspects of reality. And one is the facts, the timeline, what happened, when did it happen, things like that. Hey, buddy, what are you doing? This is an otter. I'm trying to go into the blankets. And then there is, oh, hi, buddy. Then there is the story. And the story is what we made up about those facts. So the story is getting more into back in 2003, I didn't do this thing. And that means that's why this happened in 2004 and things like that. And the story is basically things we make up. Yes, maybe they're logical conclusions to make, but in reality, they're not facts. They're things we made up about the events that happened. And often we react from a place based on those assumptions, that story versus the facts. And so it's just a way to kind of detach the feelings from what actually happened. And I don't mean to get all philosophical on you, but it's something that I have to remind myself, like, what part of this are the facts and what part of this is what I'm making up about those facts, which may or may not be true. And usually that's not provable. So I can have my feelings and I can have my assumptions, but I have to recognize them as such. And that helps me kind of not blame myself and just say, okay, this is where we're at. And then we're going to go forward from here. So anyway, the timeline, this is, and I may be forgetting little things, but so in 2023, Gretel, she was going along. I remember when she was 11, she's a senior dog by then, but basically I didn't notice hardly any changes. And in 2023, let's see, she'll be 15 this year. So this was like 15 for 13. She's about 13. Something fundamentally changed with her. She started drinking, and this was like mid 2023, I think, started drinking excess water. And she's always had accidents in the house due to separation anxiety. So if I was to leave her, she would go potty in the house, usually in a particular spot. But she started having more accidents in the house more frequently. And I was kind of blaming the separation anxiety getting worse as she got older. In hindsight, I think it was a symptom. But I was really paranoid about Cushing's disease because that's very common in dachshunds. So I took her to the vet and wanted them to look into kidney disease. We didn't get past the preliminary blood test onto the staged, whatever it is they do to determine Cushing's disease or not. But based on the blood tests and her symptoms, our vet, who I trusted very much and have seen for over 10 years, said that she highly doubted it was Cushing's. However, Gretel's kidney values, I don't know which value, she just said her values are high. And so she was concerned about kidney disease. So they did a urine test, but that came back perfect in her words. And so she said, you know what, let's just monitor this. So we may have done one other blood test, but so it must have been early 2023, because the end of the year, she had another significant decline, or at least continued to decline. In January 2024, it was over food. Summit contended a resource guard, but they got in an altercation. And that's really unusual, but I had noticed in December that, so usually when they would be around each other and Summit would show back off signals, bare her teeth, growl a little bit or something, Gretel would listen to her, was more submissive, and she'd just go away. Like, she didn't really care. She was like, all right, never mind. And she would walk away. But in December of 2023, I noticed that change. There were a couple situations where they both growled at each other, and that was different. Summit was 5 by then, so we'd had several years of history of this relationship or dynamic they had, and that was changing. And I just kind of chalked it up to Gretel getting tired of her crap. But in January 2024, over food, they actually had a significant altercation. And I blame Summit because she's the one that's resource guarding. But when I looked back on what happened, I think it was more of a thing where Summit maybe did do a little resource guarding, but Gretel wasn't having it, and she kind of snarked back, and Summit was like, oh, no, you don't. And they got into the altercation. But that was, so, again, was like, this is different, but I just hadn't put everything together. I wasn't sure why at this point. Like I said, I thought she was just getting tired of her crap. But she continued to decline, and in May 2024, I took her into the vet. She was having a lot of bloating. Her belly was distended. It was something for months I was concerned about. She seemed gassier, but more in discomfort because she was bloated. And I was just kind of monitoring and trying to figure out what I thought was going on. It wasn't anything that screamed, get her to the vet right now, but clearly something was changing with her. But in May 2024, she had bloating. It was really bad. And I noticed that she had a protrusion on one side of her abdomen. And that freaked me out. So I made an emergency appointment at the vet and went in. He felt her stomach and was like, whoa, like there's something going on in there. And then we did blood tests. And then that didn't, when we did the blood test at that point, he said that didn't indicate anything, is what he told me. So he didn't see anything weird with the blood test. But we did an ultrasound because there was clearly a mass in there, and they found a tumor on her spleen. We were lucky that it hadn't ruptured, but it could have been slowly bleeding. We don't know, which was making her kind of lethargic. It was clearly pressing on her intestine, which might have been why she was bloating. So long story short, we decided to have her spleen removed and the tumor removed. We didn't know if it was cancer. If it was cancer, dude, privacy. If it was cancer, we weren't going to do chemotherapy and stuff, but we thought we could buy her a few months of living comfortably. So we did the spleen removal. At the time, the ultrasound revealed that there were a lot of dark masses kind of diffuse throughout her spleen or her liver. When they removed the spleen, they did a biopsy both on the tumor / liver and spleen, and nothing came back cancer. So we got a call from the vet. Congratulations. It wasn't cancer. Dogs can live really well without a spleen. And so they said, oh, she could, this is considered curative. She could live for years. So we thought we were going to lose her. We literally, that weekend when we had to wait for the surgery, did our last pictures together, had a sundae, puppuccino at Starbucks, all this stuff. And then we're up again because we're told she could live another couple of years. So I'm going to fly through this a little bit quicker because I know we've already taken a few minutes, but and I don't want to make this an hour long. That didn't help. Okay, so she didn't bounce back like I expected. I didn't expect her to be brand new dog, but the symptoms didn't seem to change at all. So I went back to the vet. And so there was my regular vet, but the surgery had to be done at this clinic, which was a 24-hour emergency clinic. So when her symptoms hadn't changed after the surgery, I went back to that emergency clinic. She has a history of back issues. They determined that she was acting the way she was or not getting better because of her back. We talked about long-term pain management between Galliprant and gabapentin. And we ended up putting her on gabapentin. And that didn't, but I talked to the vet because it had, it didn't used to, she's been on off and on pain management because of her back for a long time. And we've used gabapentin, but, I felt like something had changed and it was making her very sleepy and lethargic. So the vet said, why don't we start with a half a dose? So we did. She still did not bounce back. I felt like the gabapentin was still making her sleepy, or at least she was still sleepy from whatever was going on. But I also didn't feel like it was being effective for pain. So then I went back to my regular vet and talked to him about it, and we switched to Galliprant, which is supposed to be better on the kidneys too. And thinking back to that 2023, when our original vet said there might be a kidney issue, somewhere in there, I think she did mention to me that we should do Galliprant instead of gabapentin because it can be hard on our kidneys. But when she had the surgery and came home, they sent her home with gabapentin, and I didn't think anything of it. So anyway, now we're getting into the things I made up about it. But that is a fact. I have feelings about it, wondering if I was just so distraught and distracted about the surgery and everything that I forgot she was supposed to be on Galliprant. Or maybe I thought the Galliprant wouldn't work enough for pain from the surgery. I don't know. But gabapentin can do more damage to the kidneys. Like I said, we're getting into the story about what happened, but it is a fact. They sent her home after the surgery on gabapentin. They actually had given me also codeine I gave her, and it was way too much. But she, way too much. She was almost drooling on herself. And so I stopped giving her the codeine and things were better. But anyway, went to the Galliprant. Then she was oh my gosh, new dog. She was acting more energetic and spry. She was engaging with this guy in play, and she's never played with other dogs. It was amazing. My husband and I all the time were whoa, oh my, look at this. Look at her. Look how well she's doing. We were just absolutely amazed. And in there, we opted to have her teeth cleaned. It was something we really debated about because she would have to go under anesthesia again, but her mouth was horrible. I thought, how do I own a dog whose teeth got this bad? I don't brush them, but I've always been on it with teeth cleaning powders and chews, but she was no longer chewing. And anyway, I thought they were going to have to remove a lot of teeth. Turns out her teeth were fine. They just need to be cleaned. So she'd have her teeth cleaned. So then around November 2024, she declined again, like significantly, kind of back to where she was before the Gallup print and the new dog. And then early December, she ended up, I dachshund sit, and we watched one, and he had a bout of stress colitis. Now, I don't know a lot about colitis and if things are contagious. My understanding was that stress colitis is caused by stress, and so it wasn't something that could be transferred from dog to dog. But around that time, she had a couple incidents where she threw up and had diarrhea, and it was potentially bloody. And I say potentially because I had given her krill oil, which I usually don't give her, at least on one occasion, and that's bright red. And so what the diarrhea and vomit was red, but it could have been for the krill oil. And well, you're just gonna have to live with it. It's having a not neutered dog. Anyway. Okay, maybe not. Not gonna be a whole video of my dog's balls, but anyway. And so I had some family stuff going on. And so I scheduled a vet appointment. I just scheduled a regular one. It was a couple weeks out, but then I had some family emergencies come up and I was not in town. So my husband took her to the vet for me. The vet I was told, just took one look at her and said, oh, it's colitis. Here's some antibiotics, and sent her away. So I had written out a whole detailed email of the timeline and my concerns, and I wanted a blood test and all these things, but apparently the vet wasn't interested in reading that. So I just had to go with it. I was in a crisis situation. I couldn't deal with it, so we just went with the antibiotics, 10 days. So we went through that. Her vomiting, diarrhea stopped and everything, but she still was acting the same. So I took her back to the vet and insisted on a blood test. The blood test came back. This was a couple days after we stopped the 10-day round of antibiotics. The blood test came back, and her BUN, B-U-N, I don't know if you say BUN or just say B-U-N, but anyway, was off the charts, literally off the charts. And then other numbers were elevated to the point it said kidney disease. So he did a urinalysis, and the urine was very dilute, which also says kidney disease. Now, we live very rurally, and I'm trying not to be prejudiced about the vets, but they aren't. I have not found a vet that is up to my very high standards, that is up to the very high standard of the one I had in Seattle, but that's a long way away, and it's hard, stressful on her to travel, especially when she's sick. So we do what we can here. Anyway, he basically told me that she could die in a couple days. And so I freaked out and thought we were going to have to say goodbye to her right away. But I have thought about it, because also with the spleen thing we had, he was the one that discovered it and basically gave us the impression that it might not be worth doing the surgery. It's almost always cancer. It might buy her a month, all this kind of stuff. I talked to another vet friend, Dr. Julie Busby, who is a holistic vet, amazing. She talked me through it. Check out her website if you haven't heard of her, but very caring, very amazing vet. She talked to me for an hour and we talked through it. And after talking to her, I felt much more optimistic. We went through with the removing the spleen. But anyway, I digress. But given that situation and this one where I was like, well, what's the prognosis with this kidney disease? Like, well, it could be days. And so I'm kind of figuring out that I don't know if it's that he thinks that I should put her to sleep because she's got kidney disease, or he's just very doom and gloom about it. He's a lot of experiences we've had. He's basically like, she's old, you just quality of life, you're probably going to have to put her to sleep. So anyway, and I'm not one to have a person even in my life that I don't like them. I've been through a lot of death experiences, and So I've learned that I would rather let someone or a pet go earlier than too late. So I'm not one to drag things on, but at the same time, I changed her diet. Well, I'm changing her diet to a lower phosphorus diet. I immediately started giving her a phosphorus binder. The vet was like, fluids don't really work on dogs, but she was clearly dehydrated. Probably she was always on the verge of dehydration, at least for the last couple of years. You could tell by her skin and everything. But then the bout of diarrhea and vomiting with the colitis made her more dehydrated. And this BUN number can be really elevated if a dog is dehydrated. So I called the vet and insisted that we get hydration. I didn't want to take her in and be hooked up to an IV and leave her for days. It's not just the cost, but that would be too stressful. We basically want to keep her comfortable for the time that she has left, and we know that that is limited. So anyway, I got set up to do sub-Q fluids at home. So I've started that. I did call the vet back, told him what we were doing. He did seem positive when I said that, and I said, well, let's retest in a couple weeks. Like, should I retest in a couple weeks? And he was like, oh, yeah, totally, that's great. And I then find out that actually you need to have 3 tests in a row to diagnose kidney disease, or at least the level, like degree of kidney disease. She clearly has kidney disease, mostly, like I said, the BUN was sky high, but that's not the sole indicator or even the primary indicator of kidney disease. The urinalysis indicated kidney disease. The other numbers were elevated a little, which elevates some of the other ones involved kidney disease. But if that BUN number is back down, it could be like beginning stages kidney disease. So we're just trying to figure it out. Also, when we did the blood test, she was not fasted, which you're supposed to do the blood test like to get definitive answers when she's fasted. We were a couple days out from a 10-day round of antibiotics. During those antibiotics and the colitis, she had stopped eating, which was also a concern. Like, she started, always voracious eater, started picking at her food, and then she actually stopped eating the food for some meals, which concerned me. But it could have been the antibiotics because we were putting it in her food and it tastes bad. And she was like, I'm not eating that. Like, there were just a lot of things involved to the point where I don't know that this kidney disease is as bad as it sounded at first. We're not sure yet. We're just taking it day by day. The SDMA, so it's the IDEX is their testing system they use. SDMA is actually more reliable than creatine, which is one of the numbers they use to diagnose kidney disease. And her creatine was elevated. She's lost a lot of muscle mass over the last couple of years. That can throw off the creatine numbers, actually making the numbers lower than they actually are. So, but this SDMA is supposed to be more reliable than creatine, and it was only 1 point above the normal range. So that's not too bad in my book. I've seen people, I joined some kidney groups, and hers is 15. The normal range ends at 14, but I've heard people that have dogs and it's like 34. So on the spectrum of things, it's pretty low. So anyway, we're going to do more testing. Also, so I got the results myself to look at them. And on those results, they list the results of the blood tests in May. Her BUN was high in May, like kidney disease high. But at the time, the vet didn't say anything to us. And I'm a little bit irritated about that. Although I will say, I know he was focused on the spleen tumor, so was I. He may have said at that time, her kidney levels are elevated, but that wasn't the crisis on our plate. So I kind of discounted it. Anyway, so back to the beginning where I was talking about the facts. So that's what happened. These other things are facts, these buts that might influence how bad the kidney disease is. This video is really long, so I'm not going to get into my story about, what I've made up, what I'm beating myself up about. There are things I will just say, but I have to go back to what are the facts that I know and separate that from the things I'm beating myself up about, which are the story I made up about it, the timeline. And I need to let go. And the fact is, it's neither here nor there. It doesn't matter. Could I have done something differently? Probably. I'm almost sure there's at least one thing I could have done differently, but you know what? It doesn't matter. We're here. We're where we're at. All we can do is see where we're at and move forward. So forward is, I was going to talk more about this, but I will just say, this is from Lap of Love. It's a quality of life assessment sheet. And we are doing this. We've done this several times since last August. And now I'm doing it about once a month. And you score like some things that are quality of life: eating, interacting with other dogs, interacting with you, enjoyment of life. It is subjective, but it's more objective than just sitting around lamenting or talking about, looking at her today. So anyway, it has fluctuated over time. This is the most recent one I just did 2 days ago. And so there are 3 categories. 1 to 8 is nothing's wrong with the dog. Over 17 is you might want to think about saying goodbye. And in between, 9 to 16 is the quality of life is questionable and medical intervention is suggested. And she is 9 or 10 right now. So she's at the low end of that middle range. We are doing medical intervention. So the other thing about the kidney thing is there are the numbers, but I've also learned that what matters most is how your dog is doing. Some dogs have sky high numbers and are doing fine, and some have just barely registering as bad, as kidney disease numbers, and they're not doing well. I also have to look at the rest of the picture. She's old. She's going to be 15 in a couple weeks. This kidney disease is not the only thing she has going on physically. She's got lumps. Most of them are fatty lumps. A couple are mystery lumps. She is losing eyesight. She has had a heart murmur that's been detected over the years, not consistently. So maybe the vet didn't pick it up, and or it was caused or exacerbated by stress because she's very anxious. I don't know. But and we still don't know about the liver. It came back not cancerous, but our regular vet is, based on the ultrasound, is convinced that she's still got something going on with her liver. So, there's a whole picture here, not just the kidney disease, to consider. But we're just taking it day by day. We're doing these assessments. We want to keep her as comfortable and happy as she can be. She has bounced back. If you look at our Facebook page, there's I just posted a video yesterday of her walking in the park, and that's pretty normal for her age. That's not the decline. That's actually the doing better. So we're just, she's not ready to go yet. And so we are just going to ride it out until she kind of is. So we're doing quality of life journal, lower phosphorus food, adding the phosphate binder, hydration fluids. We are trying to clarify, I am trying to clarify the actual stage, but like I said, what really matters is how she's doing, not necessarily the stage. We're going to do blood tests again in a couple weeks and see if they have changed or improved from the ones that we just had. We're enjoying the time with her, trying to make her time as comfortable as possible. We're also building a relationship with a local hospice vet that will come to our house when it's time. She's so anxious. I don't want to send her to take her to the vet to get it done. I want it to be more peaceful at home. And then we're going to be updating our Dachshund family on here probably, but also these are the longer form ones, longer explanation, but more kind of like daily, how's she doing updates on Facebook, somewhat on Instagram, although we try to keep that as our kind of fun adventure travel account. So I don't want to really start going down the road of health, but Facebook is where we primarily talk about day-to-day stuff and how the dogs are doing. So I hope this video, if you're going through kidney disease with your dog, I'm very sorry. I hope this video has helped you a little to maybe assess where you're at and cope, and maybe giving you some hope, that things, give it some time, maybe things will improve. I will do some updates here. This is my first experience with my own dog with kidney disease, but I do have a lot of friends that have had dogs and cats with kidney disease. So thankfully I can learn from them. But I just wanted to give an update here, like I said, for the people that care about Gretel. Really, our blog is the same name as the channel, but I'm not, doing these updates on the blog, but I may publish a blog post about our kidney disease journey. Anyway, so it's youdidwhatwithyourwiener.com. A lot of health stuff on there, and travel and hiking and all of that stuff, like how-tos, if you want to check that out. So we'll talk to you later. Bye.